for Epidemics, Colonel Dr. Cholo. We have Jessica, who handles health issues with USAID. Jessica. We have Dr. Kanaka from WHO. And from the Ministry of Health, USAID. Thank you. I think those are my teams. Of course, I have Abby, our public relations officer. It has been a long while since we have spoken to you about Mpox. So we thought we would give an update to the nation on the Mpox outbreak, but also touch a little bit of Marburg that is in Tanzania, not in Uganda, and answer any other questions on outbreaks that you may have. So once again, allow me to apologize for starting late, but we are ready to start if you're ready. Today, 17th January 2025, the Ministry of Health would like to update the nation on the ongoing Mpox outbreak. The Ministry provided a comprehensive update on the status of Mpox on the 6th of September 2024. The outbreak has continued to expand, with a cumulative total of 1,712 laboratory confirmed Mpox cases reported across the country. Encouragingly, 1,089 individuals have fully recovered and have been discharged from the various treatment facilities. Unfortunately, 10 lives have been lost, with the majority of these individuals having underlying medical conditions such as HIV/AIDS, malnutrition, diabetes, and sickle cell disease. As of today, 169 individuals are receiving care in designated isolation and treatment facilities. Since the beginning of the Mpox outbreak in late 2024, the outbreak transitioned from the initial phase, which was July to August 2024, characterized by random cases in Kasese, Mayuge, Amuru, and later in Nakasongo district. This period registered a few cases as intensified surveillance and targeted risk communication activities took place. The Nakasongola micro outbreak marked an acceleration phase, which was from September to November 2024, that was characterized by sustained transmission among fishing communities in Wampanga sub-county and town council. Commercial sex activities in these areas seeded the outbreak in parts of Kampala metropolitan area, including Kawempe and Lubaga divisions, as well as peri-urban areas of Koni and the transmission hotspots have been identified as Waise and Kawala. The established pockets of transmission in some places in Kampala metropolitan area are characterized by an intertwined web of commercial sex activity and male border riders, commuter taxi drivers, Uganda workers, roadside vendors, female bar attendants. To date, Mpox cases have been reported in 71 districts. Of these, 52 districts continue to report new cases, indicating sustained transmission. The good news, however, is is that 18 districts have reported no new case in the last 6 weeks, with Adjumani district entering the elimination phase, having reported no cases for over 3 months. I will speak on the key drivers of the outbreak. The Mpox outbreak is primarily driven by person-to-person transmission. And in regards to demographics, 58% of cases are male, and the most affected age group is between 19 to 39 years. In regards to the high-risk groups, the outbreak is prevalent among mobile workers. These include truck drivers and border riders, vendors, bar attendants, commercial sex workers, and casual laborers. In regards to behavioral factors, high-risk behavior such as casual sex in guest houses, the brothels, massage parlors, and saunas significantly contribute to the spread of Mpox. Large gatherings, drug abuse, and alcohol misuse exacerbate the situation. Transporters, particularly border riders, unknowingly carry the disease to new areas. When we talk about schools, poor compliance with infection prevention and control measures in some boarding schools has led to student infections. In regards to private clinics, some private clinics delay referrals and lack adequate IPC measures, further spreading the disease. Interventions to contain. The Ministry of Health is implementing the following measures to contain the outbreak. 1. Enhanced surveillance, active case search, contact tracing, and strengthened laboratory diagnostics. 2 is public awareness campaigns, dissemination of information of Mpox prevention, symptoms, and early treatment through community health workers and media platforms. 3 is capacity building. We are training health workers in case management and proper use of personal protective equipment. 4 is treatment and support, provision of care in isolation centers, and ensuring adequate supplies of medicines and logistics. And 5 is the vaccination campaign. Uganda will launch its Mpox vaccination campaign next month, February 2025, following receipt of vaccines from the African Center for Disease Control, that is the African CDC. We expect vaccines in the country next week. Vaccination will target high-risk populations, as I've mentioned, close contact of confirmed cases, and frontline health workers currently based in areas with active transmission. The 6th measure is the regulatory one. Local governments have been urged to regulate brothels, massage parlors, saunas, and unregulated gatherings that contribute to the spread of Mpox. 7 is enhancing school compliance. Schools and training institutions represent congregate communities, coupled with overcrowding, leading to a high risk of transmission of Mpox as they are high-density environments. Playgrounds, inadequate ventilation in classrooms, shared bathrooms, can increase the concentration of airborne pathogens. The safety of school-going children is a top concern for parents and school authorities in the current Mpox outbreak. Of the total confirmed cases, 362, which is 19%, are among children aged 0 to 18 years. And of these, some are learners. As part of ongoing efforts to strengthen school health capacities, we have trained 2,702 teachers from 1,440 schools in high-risk districts, and we plan to orient more teachers, school health focal persons like the school nurses, before the schools reopen. To intensify the risk perception on Mpox in schools, we developed child-friendly IEC materials, and these were disseminated in the various schools across the country. The Ministry of Health, together with the Ministry of Education and Sports, have developed operational guidelines for schools on prevention, detection, and control of Mpox in the school settings to keep learners and the school staff safe and avoid disruption of school activities. Furthermore, to address the anticipated risk of Mpox transmission, the Ministry of Health will disseminate a circular to schools aimed at preventing the spread of Mpox in schools and training institutions. In preparation for the schools reopening, the Ministry, in collaboration with the Ministry of Education and Sports, have planned orientation of the district education officers, district inspectors of schools, and frontline teachers on the prevention and control of Mpox spread. Schools should intensify the reporting of any learner presenting with signs as per the community case definition. Private clinic oversight is number 8 among our interventions. Clinics should refer Mpox patients promptly and implement infection prevention and control measures. I will now highlight the preventive measures for the general public. To curb the spread of Mpox, the Ministry urges the general public to do the following. Number 1, avoid physical contact with individuals showing signs and symptoms of Mpox. Number 2, refrain from sharing personal items like clothing and bedding with infected individuals. 3, wash hands regularly with soap and water or use alcohol-based sanitizers. Number 4, seek medical attention immediately upon noticing symptoms like rash, fever, or swollen lymph nodes. And lastly, accept vaccination when it becomes available, especially if you are among the high-risk group. As I conclude, while the outbreak remains a public health challenge, there are success stories. Ajimani district has not reported any case in over 3 months, marking a stage of interruption in transmission. The ministry remains committed to controlling the outbreak through targeted interventions and the upcoming vaccination campaign. We call upon all Ugandans to remain vigilant, adhere to preventive measures, and report suspected cases to the nearest health facility or the ministry's toll-free line at 0800 100 066. I will repeat, 0800 100 066. To our esteemed tourists, investors and traders, we assure you that Uganda is safe for travel and business. The Ministry of Health is actively managing the situation, and there is no cause for alarm. Together, we can stop the transmission of Mpox and end this outbreak. I thank you for listening to me. That was the Mpox part. I will now give a short brief in regards to the Marburg alert. The Ministry of Health has been notified by the World Health Organization of a suspected Marburg outbreak in the Kagera